Hi, it's Barton Jennings here from Lung and Sleep, and today I'm going to talk about pulmonary embolus. And I've got a few videos to show of CT scans demonstrating a pulmonary embolus. I'll talk a little bit about what it is and also about its treatment. So hopefully you enjoy it and find it interesting. So a pulmonary embolus is a blood clot lodging within the lung. Now what happens is that a blood clot will usually develop within the veins of the legs or the pelvis, and if that blood clot breaks off, the blood clot will travel up through the veins into the heart, firstly to the right atrium, to the right ventricle, and then the right ventricle pumps that blood to the heart, to the lung, and if it gets lodged within a big blood vessel within the lung, then it can cause problems. And so patients may present with shortness of breath. Sometimes they have chest pain if it causes irritation to the covering of the lung, which is the pleura. Other times they might feel lightheaded or dizzy because if it causes a big blockage to blood flow, then that can affect the ability for the heart to pump the blood, and the blood pressure might go down, and this could be a very serious complication of big blood clots in the lung. Now, blood clots in the legs develop for a few reasons, but usually it's due to the blood flow slowing down. So that might be in the setting of prolonged immobility when we're not moving, and moving helps the blood flow in the legs. So for instance, if you're in hospital for a long time or had an operation, or sometimes long plane flights. The other situation is if the blood is a bit thicker or clots more easily, and a common situation is in the setting of cancer. And so sometimes patients with cancer will have an increased risk of developing blood clots in the legs, and that can develop pulmonary emboli. So let's have a look at a few case studies to demonstrate this, and I'll show you some CT scans so you can start to understand what a pulmonary embolus is. So this is a CTPA scan, or a CT pulmonary angiogram, of a 58-year-old lady who presented with shortness of breath. She was on the oral contraceptive pill, which is a risk factor for pulmonary emboli. And I'll show you the scan. This is an axial scan where a cut through the chest, so the front is here, and this is the sternum. This is the back with the vertebra here. On this scan, the lungs are blacked out because they're full of air. So the lungs are blacked out, and the trachea is blacked out because that's full of air too. Now calcium goes white, so you can see the bones are white, and there's contrast injected into the blood vessels so that the pulmonary artery and the blood within the pulmonary artery goes white so that we can see it clearly. So this white here is contrast within blood vessels. Now just scroll down through the chest. Here's the aorta, the arch of the aorta, coming into the top of the heart. Now here's the start of the pulmonary artery. This is the pulmonary trunk, and here is where the pulmonary artery branches into the left and the right main pulmonary artery. You can see that they look normal, and the artery is completely full of blood because you can see that the blood is white. Here's the right pulmonary artery swinging around here and starting to branch off. Now as we scroll down, just in here, this is normal because the whole artery is full of blood. As we scroll down, there we see a significant abnormality. Here is the blood vessel, but within the blood vessel is this grey area, and this is a blood clot which is blocking blood flow within that vessel. And you can see that it's quite big there, almost completely blocks off the vessel. And we call that a filling defect because it is a defect that affects the filling of that part of the pulmonary artery. We're scrolling down still, and we can see that this clot is branching into this branch of the artery, and you can still see clot here. This is the airway. So there's quite a significant amount of clot here going into the right lower lobe. And if we look around carefully, there's also some other areas of clot. Here's a blood vessel here that is a normal blood vessel there, but if we scroll down a little bit, we can see clot within it there. So that's a smaller clot getting lodged in a smaller vessel. Now the next thing we look at is to see, has this blood clot caused pulmonary hypertension? Because if there's blockage to the blood flow into the lungs, then the pressure in the right side of the heart increases, and that can cause significant problems for people with pulmonary emboli if their heart is not able to cope with the obstruction to blood flow. So here we go, here's the right ventricle and the left ventricle, and the left ventricle should be bigger, and this is the septum between the two, and it should be bowing towards the right, and it is. So that's a normal finding. And if we come back to the pulmonary artery, this is the pulmonary artery as it's first coming out of the right ventricle. This is the aorta as it's coming out of the left ventricle, and the diameter of the aorta should be greater than that of the pulmonary artery, which it is. So there's no signs here on this scan that this person has pulmonary hypertension. Here is another example of a pulmonary embolus. Now this patient's had a big pulmonary embolus. The first thing we notice on the scan is that within the trachea is a little tube there. So this indicates that this patient is currently ventilated, so they're clearly extremely sick. Now as we scan down through, there's the top of the aorta again. We'll come down to the pulmonary artery, and if you have a look here, what you can see is this is the pulmonary artery, the main branch, going once again to the right, the left main pulmonary artery, and this grey all the way across here is a great big blood clot which is called a saddle embolus, and that's because it's come out of the right ventricle through the main pulmonary artery and it's lodged in the branch between the right and the left main pulmonary arteries. So this clot would have been in one of the veins in the legs. That's why it's this long, thin thing, and it's lodged right across, blocking blood flow to both the left and right. Here you can see further clot here in the left main pulmonary artery, and if we go down further, you can see further clot here, and also further clot. Here's an artery coming here that suddenly blocks off, and there's further clot going off to the right lung there. So this person has a lot of clot within the lung. Here's some further areas of clot down here. And if we just scroll through that, you can see within the normal blood vessel there's that grey, so that blood vessel is being blocked off by the clot. Once again, if we have a look at the heart, this time the right ventricle seems a bit enlarged compared to the left. There's thickening of the septum, so this is consistent with that right ventricle is struggling with the pressure caused by all of these clots within the blood vessels of the lung. If we come back and look at the pulmonary artery again, and have a look here, this is the pulmonary artery, you can see that the diameter is greater than that of the aorta. And that's because of the back pressure causing this to be dilated. So this patient has massive pulmonary emboli causing right heart strain and pulmonary hypertension. So the treatment of the pulmonary embolus is to thin out the blood, and thinning of the blood causes the body to stop producing new clot. The thinning of the blood doesn't actually break down the clot. The body will break down the clot itself, but the risk is that once there's one blood clot, it's much easier for the body to produce more blood clots. And so by thinning the blood, that reduces that risk of further blood clot. So patients usually need to have their blood thinned for 6 months. Sometimes, if there's risk for ongoing clot, they may need to have their blood thinned out for longer, sometimes forever. If there's an obvious reason for why there was a blood clot, and that reason can be removed, such as being on the oral contraceptive pill or maybe shortly after an operation, then sometimes a shorter duration of blood thinning or anticoagulation is enough. In the setting of a massive PE, such as the second case we saw, sometimes patients get benefit from what's called thrombolysis, and that is when we give a medication that actually breaks down the clot. However, this is a difficult situation because these medications can also be associated with bleeding, because you might break down clots that are elsewhere that are necessary, and the major risk is having a bleed within the brain or sometimes a bleed within the gastrointestinal tract. So for the majority of patients, they're treated with blood thinning and their body is allowed to break down that clot. So hopefully you found that interesting overview of pulmonary embolus, showing a few interesting cases. Thanks for watching.